Hello, my name is Salathiel Ray, and I will be conducting a primary survey. The first part of a primary survey is the generalized impression. The question you're trying to answer here is, are they sick? You're going to look at their appearance, their work of breathing, what skin color they are, what skin color they have, and some basic traits. When you're looking at their appearance, you want to look at their facial expressions, their eye contact, how they're dressed, how they speak, and any abnormal odors that are coming from them. And you want to figure out if this is normal for them. The next thing you want to check is how are they breathing? Do they have 3 to 4 word dyspnea? Do they have abnormal sounds such as stridor coming that are audible from a distance? And what's their position? Are they in the tripod position or the sniffing position? This will indicate if they're in any kind of respiratory emergency. The next thing we look at is their skin. Is their skin red, white, or blue? If it's white or blue, you're kind of wanting to figure out what's causing their hypoxia. If it's red, then that could be a couple other things, such as CO poisoning, that you would want to check for. And then you just want to look for basic traits. If they have any kind of deformity, or if they have speech impediments, or just something that is normal for them that could indicate that seems like an emergency situation to us. Next thing you want to check for is their AVPU, or if they're alert and oriented, time to person, place, time, and event. AVPU indicates how alert they are. Are they alert to you when you come into the room? Are they alert to verbal stimuli, or do they only respond when you do a sternal rub? And you want to make sure that they know where they are and they're aware of their surroundings, what time it is, just at the level of consciousness a normal person would be in. And you want to make sure that that level is normal. They could have suffered a stroke or have some kind of deficiencies that would indicate that they wouldn't answer as like in a normal way. Next thing you want to do is identify the emergency. Basically, what the chief complaint is. Why did we get called to come to their house? Why are we there checking them out? And you want to make sure that you understand that it's their emergency, not our emergency. Next thing you want to do is check your ABCs for major life threats. The first thing you want to check for is airway and breathing. You want to make sure the airway is patent. You want to make sure that they're breathing at a normal rate and volume. They have bilateral chest rise and fall. If you notice anything here, abnormal chest rise and fall, abnormal breathing patterns, you'd probably want to go ahead and check that out first. And make sure that their airway's open and that they're getting enough oxygen. Next thing, and then you want to check for circulation. If you see any like bleeding, if it's arterial or they're losing a lot of blood, then you want to go ahead and make sure that you correct that first. You want to control the bleeding before you do anything else. If you think it's a circulation issue, then this order of operation would be reversed and it would be CAB. You want to check for pulses here. You want to check again for the color. If they're white, then you could expect some kind of circulation issue. When you correct major bleeding, you want to first try direct pressure. If that stops it, then that's where you can stop. Just keep pressure, put a pressure dressing on it, and then keep doing your assessment. If they are bleeding through the pressure dressing, then you want to go ahead and put a tourniquet and mark the time and date. The next thing you want to check for is any previous injury or disability. Like I was saying before, if they've had a stroke or they have some kind of trauma to the brain, then this is where you want to try to get that information to make sure that the deficiencies they're presenting with now is normal for them. And you want to check for pearl. You want to make sure their pupils are equal and reactive to light. The next thing you want to do is expose any area that you suspect could be involved in a trauma or medical situation. This is where, like, if you wanted to palpate or inspect a certain body part, you'd want to go ahead and remove any kind of clothing from that area so you could identify anything that could be going wrong. And then you want to identify the need for transport. Do you want to stay and play, or do you want to go straight to the hospital? This really depends on their condition. If you had to put a tourniquet on, then that would probably indicate the need for immediate transport. If they are stable, just presented with some kind of pain or something that seems correctable or something you can stabilize and look further into, then you want to stay and try to make them comfortable for the transport.